Type 1 and 2 diabetes by Janine Scherzer. Type 1 diabetes, also known as insulin-dependent diabetes mellitus, IDDM, a chronic autoimmune disease characterized by the pancreas producing insufficient insulin. The immune system attacks the insulin-producing beta cells in the pancreas, also known as juvenile onset diabetes because it typically appears during childhood or adolescence. Possible risk factors. The exact cause of type 1 diabetes is unknown. Exposure to environmental factors such as viruses can trigger the disease. The occurrence of type 1 diabetes seems to increase with insufficient amounts of vitamin D. And introducing cow's milk to an infant's diet too early can potentially increase the risk of type 1 diabetes. Type 1 diabetes etiology, family history, having a parent or sibling with type 1 diabetes, genetics, the presence of certain genes, geography, living farther away from the equator, your age, peaks at the ages 4 to 7 and 10 to 14, type 1 diabetes demographics, is more common among children and young adults, and here's a chart that shows that the adolescents ages 1 to 5 and 6 to 10 are pretty much higher. Disease mechanism. The immune system attacks its own organs and tissues, which is a factor in the initiation of type 1 diabetes. People with type 1 diabetes do not produce insulin. Insulin acts as a key to cells that open so they can receive glucose. Without the proper key, glucose can't move from the body into the cells, and the glucose stays in your blood, causing hyperglycemia. Disease mechanism continued. Insulin-dependent diabetes, or IDDM, occurs as a result of decreased production of the hormone insulin by the pancreas, which is the organ that synthesizes insulin. This occurs due to the loss of insulin-producing cells, which are beta cells in the islets of Langerhans within the pancreas. To compensate for the death of the beta cells, people with type 1 diabetes need to inject themselves with insulin. And everyone with type 1 diabetes is insulin dependent. Disease mechanism visualized, and here's a picture that shows type 1 diabetes and how it works. The stomach changes the food into glucose. The glucose enters the bloodstream into the blood vessel. The pancreas makes little or no insulin, and then little or no insulin enters the bloodstream. Therefore, glucose builds up in the bloodstream. On a cellular level, with type 1 diabetes, the immune system destroys cells in the pancreas to make insulin. And here's the white blood cells attacking the pancreas that secretes the insulin. Moderate side effects: frequent urination, unusual thirst, extreme hunger, weakness, fatigue, heavy breathing, blurred vision, irritability, nausea, vomiting, restlessness. Long-term complications include heart disease, hypertension, nerve damage, blindness, kidney failure, stroke, amputation, and peripheral vascular disease. Testing for type 1 diabetes. The lab tests that are involved with type 1 diabetes includes glycosylated hemoglobin test, A1C. This test examines the blood levels of glycosylated hemoglobin, HbA1c. It's not affected by the recent food intake. And there's a fasting plasma glucose test, and this requires 8 hours of fasting before taking the test. And there's an oral glucose tolerance test, which is drinking concoction 2 hours before. HbA1c test results. Normal HbA1c levels should be in the range of 4% to 5.6%. HbA1c levels of 5.7% to 6.4% means a patient has a higher chance of developing diabetes. A level of 6.5% or higher means the patient is a diabetic. Patient should be tested every 3 to 6 months. Fasting plasma glucose test results. These normal levels are considered to be 100 milligrams per deciliter or below. Prediabetes, the levels are between 100 and 125 milligrams per deciliter. Being a diabetic, you're 126 milligrams per deciliter or higher. If a patient receives a high-end reading, it's recommended that they get retested for validity. An oral glucose tolerance test, OGTT, the results are normal levels are considered 140 milligrams per deciliter or below. Pre-diabetes, the levels are between 140 and 199 milligrams per deciliter. And with diabetes, you're 200 milligrams per deciliter or higher. Are recommended as a follow-up for a fasting plasma glucose test to further verify the results. And there's the solution that you would consume for those tests. Treatment methods. Dietary adjustments can be made to improve the patient's blood sugar levels. Blood sugar levels should be monitored throughout the day. Normal blood sugar levels are between 70 and 130 milligrams per deciliter. And then 2 hours after you eat, 180 is a normal level. Increasing your daily exercise and activity level will help. Getting adequate rest, insulin therapy, of course. And then there's the option of pancreas transplantation surgery. Glucometer testing is equipment used to test blood sugar levels. It usually includes a glucometer, lancets, test strips, and a control solution. And the picture on the left is all of that, the glucometer, the lancets, and the test strips. And then on the right is just a picture of showing you how you prick your finger and check your blood with the strip. Insulin therapy is administered using a needle. Can be injected into the patient's arm, leg, stomach, or backside. And it starts to work immediately or prolonged depending on the onset and duration of the medication you're administering. Types of insulin. There's rapid-acting insulin, and the brand name is usually Humalog, Novolog, or Epidra. And the onset, which is the length before the insulin reaches the bloodstream, is 10 to 30 minutes. Then there's short-acting insulin, which is regular, and that onset is 30 minutes to an hour. And intermediate-acting insulin, usually NPH, and that onset is 1.5 to 4 hours. And then there's long-acting Lantus Levemir, which is 1 to 4 hours of onset before it reaches the bloodstream. And note that Lantus and Levemir brand insulin can never be mixed with any other insulin. Then there's an insulin pump, delivers rapid and short-acting insulin 24 hours a day. The doses are separated into basal rates, bolus doses to cover carbs in meals, or correction or other doses. And here's how a insulin pump works. There's a little cartridge that's called a reservoir, and that's where your insulin is, and then it travels through like a cannula into the needle that's implanted under the skin. Other explored treatments. Islet transplantation transfers cells from an organ donor into the body of another person. Beta cell regeneration can be done in 2 ways. One way is create stem cells and transplant them, or take drugs to make them grow. There's also insulin gene therapy, and all have been explored in the attempt to cure type 1 diabetes. And here's my scenario. SC has been an active 13-year-old. She has a brother, age 17, that was diagnosed at 10 with type 1 diabetes. Her blood sugar is currently 397 milligrams per deciliter. Her blood pressure is 90/65. Her pulse is 126. Her respirations are 28, and she's 5 foot tall. Her temperature is currently 99.5, and her weight is 87 pounds. She complains of nausea and vomiting, and despite increasing her food and fluid intake, she has lost weight. So question 1. SC asks, some people I know with diabetes can take pills. Why can't I take pills instead of having to take insulin? What's an appropriate response to her question? The answer, if you have type 1 diabetes, pills won't work. She'll have to take insulin. Type 2 diabetics can take pills. Question 2. What's the single greatest risk factor for type 1 diabetes mellitus that this patient has? The answer, the patient's sibling has type 1 diabetes. Question 3. Why is it appropriate for the physician to inquire about fever, chills, diarrhea, cough, sore throat, and painful urination? The answer: in case the patient has an infection, type 1 diabetics are more prone to infection of foot infection, skin infection, urinary tract, vaginal infections, and kidney disease. Question 4. Is the patient technically underweight, overweight, obese, or is the patient's weight healthy and normal? The answer is the patient is underweight. She's 5 foot tall and only weighs 87 pounds. Type 2 diabetes. Type 2 diabetes is a metabolic disorder characterized by high blood sugar, insulin resistant, relative lack of insulin. Type 2 diabetes primarily occurs as a result of obesity and lack of exercise. Type 2 diabetes etiology: develops when the body becomes resistant to insulin, develops when the pancreas stops producing enough insulin. And here is a picture that shows you how the glucose enters the bloodstream and into the vessel. The insulin enters the bloodstream, and then the insulin is resistant, so the glucose can't get through, and it makes too much circulation in the bloodstream. Type 2 diabetes. And here's another picture that shows you the stomach and the pancreas and how the stomach converts the food to glucose. The glucose enters the bloodstream. The pancreas produces sufficient insulin but is resistant to its effective use. Therefore, the glucose is unable to enter the body effectively, and then the glucose levels increase. Type 2 demographics. 1 out of 3 adults has prediabetes. 29.1 million people in the U.S. have diabetes. About 1.4 million new cases of diabetes are diagnosed in the U.S. every year. About 8.1 million may be underdiagnosed and unaware of their condition. And if both parents have diabetes, a child's risk is about 50%. Contributing risk factors of type 2 diabetes is older age, excess weight, family history, certain ethnicities, physical inactivity, poor diet, smoking, insulin secretion defects. Diabetes mechanism. A decrease in beta cells mass is likely to play a role in the pathogenesis of human type 2 diabetes. A progressive decrease in beta cell function leads to glucose intolerance. A decrease in the number of functional insulin-producing beta cells contributes to type 2 diabetes. And the clinical manifestations must be present with all of the following. Classic symptoms of diabetes mellitus includes polyuria, polydipsia, polyphagia, weight loss, and random plasma glucose of greater than 200 milligrams per deciliter. Fasting plasma glucose is greater than 126 milligrams per deciliter. And 2-hour post-glucose load, 75 grams plasma glucose greater than 200 milligrams per deciliter, and a confirmed by a repeat test. Cellular. Type 2 diabetes islet cells are destroyed, unable to control blood sugar, circulate in the bloodstream, and create many adverse side effects. And here's a picture of the pancreatic islets, and this is the beginning of infiltration of the white blood cells. And then on the right side is the pancreatic islets that shows the stages of infiltration and that the insulin-producing cells have been destroyed. Testing for type 2 diabetes is the same as type 1 diabetes, and it includes the glycated hemoglobin A1C test, a random blood sugar test, fasting blood sugar tests, oral glucose tolerance test. And there's again, the same unit that you would use with the syringe and the monitor. Side effects and complications. The side effects of type 2 diabetes is hyperglycemia, increased urine excretion, increased thirst and dehydration, blurred vision, lack of energy. And the complications of type 2 are cataracts, severe infections, retinopathy, kidney disease, neuropathy, renal failure. Complications continued. Diabetic foot ulcers, and here's a picture of a venous stasis ulcer on the leg and then the diabetic foot ulcer. Type 2 diabetes scenario. CB, significantly overweight female from an Indian tribe. She has high blood sugar and cholesterol levels. Complains of left foot weakness and numbness for the last 3 weeks. She complains of being thirsty and urinating often. She's gained 15 pounds in the last 6 months. She's had hypertension for over 10 years. She's had gestational diabetes of all 4 children 14 years ago. Her younger sister has type 2 diabetes. She rarely exercises. She smokes 2 packs of cigarettes a day. Consumes meals rich in fats and refined sugars. And she suffers from severe osteoarthritis for the last 4 years. Takes pain medication to alleviate the pain in her hands and knees. And suffers from constipation. Question 1. What is the significance of this patient's cold feet and diminished peripheral pulses in the lower extremities? The answer is peripheral vascular disease causes impaired circulation, which is a risk factor for diabetes. Question 2. List a minimum of 5 risk factors that predispose this patient to type 2 diabetes. And the answer is she's got a history of gestational diabetes, her family history, her weight, she's Native American, she's inactive. Question 3. Why is the patient taking stool softener docosate sodium? And the answer is the patient takes pain medication for osteoarthritis, and the side effect of the medication is constipation, so a stool softener is needed. Type 1 and type 2 diabetes comparison. Some of the symptoms of type 1 and type 2 diabetes are similar. The symptoms come on more quickly in type 1 diabetes. Type 1 diabetics don't produce insulin. Type 2 diabetics do produce insulin. And the comparison is of type 1 and type 2 diabetes continued. Testing for type 1 and type 2 diabetes are about the same. Type 1 diabetics are diagnosed during childhood, and type 2 diabetics are typically diagnosed after the age of 40. With type 2 diabetics, beta cells are not attacked. Type 1 and type 2 diabetes comparison, and here's a picture. The age of onset for type 1 is juvenile, type 2 is in adults. The cause of type 1 diabetes is it doesn't produce any insulin. Type 2 diabetes, they're insulin resistant or obese. The prevalence of type 1 diabetes are 5%, type 2 diabetes are 95%. The symptoms of type 1 diabetes is severe and less severe in type 2. The progression is abrupt in type 1 diabetics and it's gradual in type 2. The consequences of having type 1 diabetes is the same with type 2 diabetes. It affects your kidneys, eyes, and cardiovascular system. The treatment of type 1 diabetes is insulin, and the treatment for type 2 is usually weight loss. Diabetic retinopathy in type 1 and type 2 diabetes is the leading cause of blindness in adults. Aggregating factors include people with uncontrolled blood sugar levels, women who are pregnant and have type 1 or type 2 diabetes. The risk of vision increases the longer a person has diabetes. And here's a picture of a normal retina and then an abnormal retina. And you can see right there is the leakage from the blood vessels. Gestational diabetes mellitus. The patients are glucose intolerant during pregnancy. It occurs in 3 to 7% of women in the U.S. About 50% of women with gestational diabetes will develop type 2 diabetes later. Careful management is important because women with gestational diabetes mellitus are at higher risk of severe complications in their pregnancies and mortality rate and fetal abnormalities. And treatment of diabetes. If you restore the body's ability to regulate insulin at a cellular level, you can accurately adjust your blood sugar levels without insulin injections or other medications. There's a little picture. Type 1 and type 2 diabetes by Janine Scherzer. Thanks for watching.